factors that are necessary to complete a treatment. There are 4 limbs which are needed to complete a treatment to make the treatment effective. Welcome to yet another shloka of the week. Okay, here today we will be discussing about a few points which we actually need. It's a must for us to have an effective treatment. Okay, there are certain things which have to be fulfilled. These are basically the 4 limbs which you have to have, which will actually make a treatment effective. Okay, the reason why we do all these things is to make the treatment effective, right? For these things, we need these 4 limbs. Okay, so this has been beautifully explained by Ashtanga Hridayam in the first chapter, in the 28th shloka, Ashtanga Hridayam. Okay, the 4 limbs for treatment. Okay, let's go through the shloka. Bhishak, Dravyani, Upasthaata, Rogi, Chadushtayam. Chikitsidasya nirdishtam pratyekam tat chaturgunam. Okay, so here what we are going to see, so there are 4 limbs for treatment. Bhishak, Dravyani, Upasthaata, Rogi. That's Pada Chadushtayam. Pada means limbs and Chadushtayam means 4. Okay, so we need basically 4 limbs to get a really good treatment. Okay, so let us try. You can look at the transliteration also there. Bhishak, Dravyani, Upasthaata, Rogi, Pada Chatushtayam, Chikitsidasya nirdishtam pratyekam tat chaturgunam. Now let us get into the meaning of it. Okay, the 4 limbs for treatment, for an effective treatment, are Bhishak, that is the physician or the doctor. Dravyam. Dravyam is all the substances you use for treatment. It can be medicine, or it can be the food, or it can be anything, whatever. Dravyam can be anything. It need not be only medicine. Okay. Upasthaata. Upasthaata is a person who is, if a person is admitted, you'll have a person who assists the patient. In India, we sometimes call them a bystander. Okay. So a person who assists the patient, who is there with the patient, taking care of his day-to-day activities. So that is a Upasthaata. And then of course you need the Rogi or the patient. If all these 4 things are there, then only it becomes an effective treatment. If one of this thing is missing, it doesn't become effective. And the second part of the line, second part of the shloka, we'll see that Chikitsitasya nirdishtam pratyekam tat chaturgunam. Okay, that means each and every limb, that is Bhishak, Dravyam, Upastha and Rogi. These are the 4 limbs, and each and every 4 limb has been attributed 4 qualities. So you have to have 4 limbs and 4 limbs having 4 qualities each. Okay, so if these 4 qualities for these 4 limbs are there, only it becomes a very effective treatment. So let us try to understand a little bit more deeper. Okay, so if one of these limbs are not effective, if the doctor or the physician is not focused, or the patient doesn't follow what the doctor says, or if the medicines are not very good, it doesn't become an effective treatment. So it is very important that all the 4 limbs with all the 4 qualities are supposed to be there to have an effective treatment. You have to have a hospital, and you have to have a doctor there. You have to have the patient there, and then you have to have whatever dravyas, could be food or medicine, all those things have to be there. And then the person supporting the doctor is not very important. The person who assists the patient is very important. Okay, so these 4 limbs, if you have in place, with the 4 properties attributed to them, which we'll be seeing in the coming weeks, then your treatment will become the best treatment. Thank you.